We're coming up on 6:19. You know, being a kid means playing outside, and that can also expose your child to injuries, allergic reactions, major sunburns, and a whole lot more.
If your kid does get hurt, how do you know if he needs a trip to the ER or treatment at an urgent care center, or can he just wait to see your regular doctor? Is there some sort of rule of thumb here? We're joined now by Dr. Mitch Ross. He's medical director of the Pediatric Intensive Care Unit at Providence St. Vincent Medical Center. Dr. Ross, how are you this morning?
I'm quite well. How are you?
Very well. Looking forward to this. What are some of the common injuries that kids get over the summer?
Well, there are several things. One of the most common things are falls. You know, this time of year, with the heat out there and a lot of us not having air conditioning, a lot of times we leave our windows open. And every year we see kids who fall from second-story windows, either from an apartment or the upstairs of a house. And those screens in the windows really are not very protective. So it's important to keep the windows either closed or have a limit to how wide the window can open so that kids can't fall out. Another common thing is just being outside and playing. You know, kids are out on their bicycles. Older kids are sometimes on motorized vehicles like ATVs. It's important that they have bicycle helmets to protect their heads from falls.
You know,
another major area is just being in the water. You know, drowning is a real risk this time of year because kids are outside playing in the water. It's important that parents have eyes on the kids all the time. And another thing is burns. You know, kids are playing with fireworks. They're around campfires. You know, common injury in the summer.
All right, let's talk about what happens if your child does get hurt. I mean, how do you decipher whether you go to a care center or an emergency room at a hospital?
Well, I think it's in some sense common sense. If your child has a minor thing, a rash, a minor allergic reaction without difficulty breathing, a sprain or a strain without an obvious broken bone, those sorts of things can be taken to the immediate care center. Major things, you fall and you hit your head and you're not back to normal mentally. You have major difficulty breathing with a severe asthma attack. Kids exposed to poisons. Those sorts of, a child who has a seizure, those sorts of things need to be taken care of in the emergency room.
Dr. Ross, we've heard that Providence alone sees 32,000 kids a year in its emergency rooms. Providence St. Vincent recently opened a pediatric intensive care unit. When would a kid need to go there?
Well, we take care of kids in the pediatric intensive care unit when they have severe illness. So a child who has severe respiratory disease, say, for example, a child with severe asthma that's not responding to straightforward measures, a child who has a major infection with that's having whole body effects, affecting blood pressure, stability, those sorts of things, and major poisonings, major injuries.
Dr. Mitch Ross is medical director of the Pediatric Intensive Care Unit at Providence St. Vincent Medical Center.